The first part of the question is that the factors affecting men and women. Um, the factors affecting infertility is, of course, there are many, is multifactorial. And most importantly, when it comes to treating the problem, we need to find the exact cause of the problem to individualize their treatment. For example, men can be things like low sperm count due to varicose or even substance abuse, because nowadays a lot of men are trying to build their bodies and all. So they tend to use a lot of these androgen kind of supplements which will suppress their sperm production. And and history of sexually transmitted diseases where they cause infection and overall medical problems too, like obesity, your endocrine issues like hyperprolactinemia. All these things also can affect the man's sperm production. And the other things also, not only about sperm production, but also things that can cause erectile dysfunction. ED is a very, very common cause nowadays. And as for women, it all depends on the site of the problem. For example, the ovary and ovulatory cycles, polycystic ovarian syndrome seems to be a very common disorder nowadays. Even things like endometriosis, especially when you have a stage 4 endometriotic cyst or stage 4 endometriosis, then the probability of conceiving naturally is very, very low. Then you have things like fibroids, endometrial polyps, which make the inner lining of the womb very uneven. Okay, so those things also will cause difficulty in conception, plus also increase the risk of miscarriage. Now, coming to environmental factors are like toxins. Of course, in people working in areas like in industries, industrial chemicals, okay, all these things will cause infertility. That they can impede their chance for having healthy sperms or even eggs. Okay, and among the farmers, for example, the use of a lot of herbicides. Okay, sorry, pesticides. Pesticides are the ones too, which when you overuse them, then there are chances that you make yourself unhealthy through the direct exposure to the pesticides too, solvents and all. Especially when workers who are working in the paint industry, even the varnish industry, they have lots of chemicals there. So most importantly, we have to try our best to advise the patients to minimize their exposure to those kind of environments as much as we possibly can. But you must understand a lot of them are working in this industry, so it will affect their income too. But certain amounts of advice, for example, healthy lifestyle, multivitamins, antioxidants, those are very, very important for those group of people. See, the reason why we are unable to reach that 100%, that every fertility doctor, every fertility unit wants that 100% success rate. The problem is infertility is multifactorial. Okay, it can range from the woman's problem, the male problem, the lab problem. Okay, you can the embryologist, the doctor, the medication. There's goes down to hormonal, genetic issues, environmental factors. So there are a lot of variabilities when it comes to infertility treatment. Okay, I guess we are the only ones in the whole medical fraternity where our treatment is not 100%, 50%, 30% at best. Okay, so I guess the reasons are there is so much more for us to learn about human beings than what we currently know. Okay, an example, as we are getting better and better at it, I'm quite sure. But for example, now the relationship between the embryo and the endometrial lining, the womb, that relationship, there's so many markers, there's so many things which we are still not clear as to how things are. So I guess there's still a long way to go before we can reach that 100%. And the other thing is that but I'm sure as time goes along, we will learn more things and start tweaking our IVF or our fertility treatments. But the problem is this: number one, anything that you do, it'll cost money. So whatever treatment that you have, whatever test you do, will eventually escalate our cost. But of course, yes, it'll increase our success rate by increase our cost. So So I guess there's more research work to be done in terms of their womb lining, the eggs and the sperm, and basically also the environment and the lab practices. Yeah, these are probably the reasons. Lots of variables when it comes to infertility, because as much as we try to mimic environment, okay, there's Mother Nature. There's many things that we still don't know. So hence, I think there's still a lot of things that we need to do. Yeah, that's my take on it. So I think by time getting 100% is still it's definitely there, but I think it's still far away. Well, psychological stress is definitely there in fertility treatment. One thing is that especially when these couples end up going for their family functions and all, and then a lot of these elders in the family will ask them, so where's your child, when are you planning to have a child? So these questions can be very, very personal and disturbing for many couples. And it's sad that this stigma is even in year 2021 is still there, and some people look down upon these patients, these couples who are unable to conceive. But then again, I think it's also something for us to do. We need to, as medical personnel, we should educate the general public. Look, fertility is a medical problem, and there are certain things that can be done. So we shouldn't look down, shouldn't especially stress out these couples. So as for the couples, for example, the stress of having go through fertility treatment, yes, it's definitely there. It's not only emotional stress, it's mental, it's even financial stress too, because fertility treatment, it's very costly and tedious, so it can affect their job and all. So, but most important thing, I think, when it comes to the couples who are having emotional stress, us doctors should be the first people to to behave like their counselors, because we are the ones who are going to speaking to them day in, day out about their fertility treatment. And we should also look into their mental or emotional situation too, in terms of counseling, talking to them, giving them a helpline. Like most of the clinics, they have they have groups, support groups. Support groups are something which are very, very good, because all the couples of similar who having that problem will come in and speak about it, and then and it's run by certain like psychologists or counselors. In our center, we do have every patient who comes in sign up for our IVF treatment. We have a kind of a mental coach for them, right? The emotional coach, mental coach. So what she does is she speaks to them. These patients end up talking to them even more than what they talk to us at times. Okay, and it's definitely good for them, because they can take all their emotion. I mean, they can address their emotional problems. Like some people, they've been going through treatment for many years, and then they've seen certain doctors have told them a certain thing, so which has overall stressed them out. So, and this emotional coach can put that, mental coaches can put that that problem at rest. And the other thing would be like things like alternative care, like for example acupuncture. Okay, some women find acupuncture, for example, to be very, very what do you call it? It's a kind of de-stresses them. Okay, relaxing, and they find themselves even more at ease, less stress when it comes to when they start their IVF treatment. So yes, psychological problems is something very, very important. We should need to look into. The other thing would be for men, when they are totally stressed out, and when it comes to the day when they're supposed to give their sperm sample, when they are really stressed out, then they will be unable to produce sperms. Okay, now that will be, in my opinion, a disaster. So most importantly, we have to speak to them, find out what's been what their background problem is. I think for most people nowadays, they just want reassurance. Like, look, we can help them. And as for doctors, and as doctors, we should have a very clear outline as to how we want to go about their treatment. Okay, and it also helps when when inform them about the financial implications and how much it might cost, and give the patient time to go back home, give them information leaflets, give them let them speak to the finance staff first before they go home. In that way, they will have a more clearer picture as to what is involved in their fertility treatment, how much does it cost, okay, and the helplines, care lines, where they can talk to the people before they go into an IVF treatment. So at least when they go into an IVF or fertility treatment, then all their doubts and all their stresses would have been addressed first. And that way, I think the outcome is much better. Well, for us fertility doctors, the most important legal thing we need to ensure is do not mix the gametes. Okay, every patient's sperm or eggs when embryos must be properly labeled. There are many systems now in place where they have this barcoding, they have this artificial intelligence methods which are there to ensure, okay, these computer program systems which are in place in many fertility units, which ensure proper identification of the gametes and even the embryos. Okay, that's number one. Number two would be when it comes to cases of a sperm donor or egg donor, we have to ensure that it's either anonymous or if they're known, then there must be certain guidelines in place that we avoid disputes between both the parties, the recipient and the donors. Okay, and consent forms, for example, should clearly state all the risk and involved, or the benefits involved also, the risk and benefits in fertility treatment. And patients should go through the consent forms before embarking on the IVF, because that generally reduces the risk of any medical issue, of not knowing something and something was done. Okay, and for doctors also, I think it's important for us to clearly state what kind of treatment we're going to do for the patient. The problem happens, in terms of medical-legal problem, happens when there is a lack of communication, when there's something goes wrong and the patients are not informed adequately. And then, of course, then they will start questioning, doubting the doctor's practices. So it's important that the communication takes place. The other issue would be, they had for example, now they did endometrium study of their womb lining, and they found the best timing for conception and for implantation. Then they did the pre-implantation genetic testing and found the best embryo for transfer, and yet they don't get pregnant. So a lot of them in their mind is like, this is 100%, this is going to work 100%, but it's important that we have to tell them, in fertility, there's no 100%. Unfortunately, none. Okay, so in and all this has to be stated clearly in your consent form and clearly told to the patient and documented. Okay, and that will reduce the medico-legal implications subsequently. Well, I think I don't think there's anything which is been made separately, but in terms of any abnormalities to the offspring, but that's part of our counseling too to patients. Okay, now consent form is written, and also it's written in a consent form, and also during when our counseling sessions with our patient, when explained regarding the whole IVF treatment. Okay, so what we explain to them is this: that the outcome of the baby, with regards to whether it's healthy or not healthy, depends on the parents. Okay, if the father or mother have a genetic problem, then of course it will pass on to the child. Okay, but IVF per se, fertility treatment per se, will not cause the baby to be abnormal. Okay, the best example for this is Louis Brown. Louis Brown is the first IVF baby that was born in 1978. The best thing is that she conceived naturally and delivered to a healthy baby. So this point proves that IVF does not cause any abnormality to the offspring. Secondly, right now there are millions of babies that have been born through IVF, okay, since 1978 till today, and the babies do not have any rare or any specific problems, and all the genetic problems are generally related to the parents. If the father has a certain abnormality, then of course the baby will have. For example, you are thalassemia carrier. Okay, of course the baby too may be a carrier unless you do a pre-implantation genetic testing to rule out that thalassemia gene. Then you can avoid it. Or you have a Y gene defect, then or a certain X gene. So there's certain things that you can do where you can avoid like genetic testing to avoid the baby from getting the disease from the parents. Okay, like a Y gene, then Y chromosome from, then you can look at getting baby girls, for example. Okay, it's related to the X chromosome rather than the Y chromosome. Okay, so so in short, IVF babies are as normal as the general public, provided the parents are normal. If the parents have a problem, then of course the baby too may, not necessarily so, may have an issue too.